anesthesia is a state that one enters during surgery in which you are rendered unconscious. The way we do that is through various medications and different levels of medications depending on the procedure and how stimulating it is. Anesthesia is safe, of course, and the whole process is there to keep you comfortable during a procedure, and then to keep you, generally there's different types of anesthesia. There's something called general anesthesia where you are rendered totally unconscious. Not all procedures need to be done with general anesthesia. There's other types of ways to keep you comfortable during surgery. There's something called regional anesthesia where we do what's called a nerve block, where we would numb up a certain part of your body. So for instance, if you're coming in for wrist surgery, instead of going under general anesthesia for a procedure, oftentimes we or the surgeon or the patient prefer to have regional anesthesia, where we would numb up part of your arm, which would allow the surgeon to operate. And while you weren't asleep, you would remain comfortable. Regional anesthesia and local anesthesia are oftentimes used interchangeably, but they're not exactly the same thing. So local anesthesia usually means a surgeon would inject some numbing medication into the area where he's working, and then the anesthesiologist would give you some sedation for the procedure. Regional anesthesia generally means something where an anesthesiologist does what's called a nerve block and numbs up a larger portion of your body. Local anesthesia might work for something like if a surgeon is working on your toe, for instance, but if he's doing a larger procedure on your ankle or your knee or your leg, you would probably need a regional anesthesia.
Coming to the types of anesthesia, it can either be general anesthesia or regional anesthesia. Based on the type of surgery, after discussion with the surgeon, we can decide the type of anesthesia the patient will require. Now, the regional anesthesia, it can be either local anesthesia or nerve blocks or spinal or epidural anesthesia. Coming to general anesthesia, it can be administered either through mask or through laryngeal mask airway or through endotracheal tube.
When patients come to the hospital for their surgery, they will meet an anesthesiologist who will discuss the type of anesthesia that they'll need for their surgery. It's most often going to be general anesthesia, which is the deepest form of anesthesia. Patients will be rendered completely unconscious. They should not have awareness during their surgery. General anesthesia is obtained through the use of multiple medications, most of which will start off through the IV and then be converted over to inhaled anesthetics after the patient's asleep. The anesthesiologist uses a combination of different medications. Some of them are sedatives, some of them are narcotics to relieve pain, and some of them are hypnotics to decrease awareness. The combination thereof helps the patient to be comfortable during the surgery. Each patient is different in terms of what we need to give them for anesthesia. Patients who are older and have more medical conditions often require less medication or different types of medications as compared to younger and healthier individuals. The anesthesiologist will meet each person before they go back for surgery and help develop a tailored plan for their anesthetic during the course of that surgery. Patients are often concerned about the amount of medication given and how easily they might wake up from the anesthesia afterwards. It's not uncommon for us to change medications depending on their experiences in the past to help make sure that this time they're awake and alert as soon as they can be. For some types of procedures, we can use a less deep form of anesthesia called deep sedation or monitored anesthesia care. With this type of sedation, we do not need to place a breathing tube, and we can just give medicines through the IV. Patients sometimes recall hearing voices or opening their eyes momentarily, but they're comfortable and do not have pain during the procedure. I hear patients are sometimes concerned about receiving medication that will cause them to say things they might regret later. That's not usually a concern. Folks do tend to relax with the medicines we give before we go back to the operating room, but they don't relax so much that they start saying things that are unusual. And if anything is said, it's always kept within the operating room. We know that they're under extra medications, and it's not a concern to us at all.
During your labor, you'll have different pain relief options available to you. These options may change depending upon your medical condition. During a normal vaginal delivery, one simple option is to administer pain medication through your IV. The IV pain medication may be enough to lessen the pain as you go through the first and second stages of labor. There are times, however, when you'll feel that more pain relief is needed than what you're getting from the IV pain medication. In these cases, a procedure called an epidural can be done. An epidural is a procedure where a small tube will be placed through the skin of your back using a needle. The needle is then removed and special pain medicines given through that tube to provide you with a higher level of pain relief. This medicine is typically continued right up until when the baby is delivered. Even if you want to give birth vaginally, there are times when it may be necessary for your obstetrician to recommend delivery by cesarean section. If you already have an epidural in place, this will most likely be used to give you additional medicine so you don't feel any pain during the surgery. If you're scheduled for a cesarean birth in advance, or a cesarean birth is recommended while you're in labor, but you don't have an epidural in, you'll most likely receive spinal anesthesia. Spinal anesthesia is an injection of medicine through the skin of your lower back. This medicine will make the lower part of your body numb temporarily so that you don't feel any pain during the surgery. There are rare times when it might be necessary for you to receive general anesthesia for your cesarean birth. General anesthesia is where you're given medicines through your IV, and these medicines will make you go off to sleep for the surgery. Anesthesia medicines will be continued that will keep you asleep until the surgery is completely done. Regardless of the kind of anesthesia that you have for your cesarean birth, you will receive pain medication to help you to feel as comfortable as possible after the surgery. We at Allina Health are fully committed to seeing you through the birth process as comfortably and safely as possible.
The risks of general anesthesia are very, very small, but present. But we here at Emory Aesthetic Center, we do many things to minimize the risks. Complications can include everything from sore throat and hoarseness to allergic reactions, nausea, muscle aches, headache, but we do many things to minimize those from the very beginning. You will be given an anti-nausea agent before you wake up from your general anesthetic. You will also be given pain medicine that will be working before you wake up as well.
There are certainly side effects from anesthesia after surgery, as there are for most medications that people take. Pain medication works wonderfully for pain and should be given during surgery, and oftentimes patients require it after surgery when they go home. But pain medications can cause drowsiness, can cause sometimes patients become a little disoriented. The important thing to know is that most of these side effects are minimal, and most of them last for only a short duration of time.